Annual wellness visits can be an effective, reimbursable way to collect a patient's health information and history. While AWVs are sometimes confused with physical examinations, this assessment instead starts a conversation about general well-being. The goal is to ultimately use an AWV to develop a personalized preventive care plan. As more physicians face the transition to value-based care, wellness assessments can help your practice address specific performance areas and connect patients to care management services. In this conversation, we'll discuss how AWVs can help practices create value in care delivery and how technology can simplify providing them. Joining me to discuss this is Dan Godla, the founder and CEO of ThoroughCare, Incorporated. Dan founded ThoroughCare in 2013 by creating an intuitive software platform to enhance chronic care management through digital care coordination. Today, ThoroughCare offers a comprehensive care coordination portfolio, including software, mobile, and analytics applications, supporting more than 600 physician practices and clinics across the country. You can learn more at www.thoroughcare.net. Dan Godla, thanks so much for joining me today.
Hi, Chris. It's my pleasure.
So let's talk about annual wellness visits. Why should physicians and other providers offer annual wellness visits?
Well, it's one of those services, Chris, that pays extremely well and patients really like. And sometimes the doctors do a lot of the things that count towards the annual wellness visit, but they don't bill it. So the patient's in there for one of their normal visits and they ask a lot of questions. Those are things that could be done in a wellness visit, and doctors are just including it into the regular appointment. And patients like this because it's one of those Medicare services that has $0 in copay. Patients like to get free things. And when you tell them that, hey, you get one of these every year, it's something that they don't want to turn down. So it's well liked by the patients. It pays good by Medicare. And the best part is it leads to finding additional services, finding things that maybe the patient should be doing or identifying some risk factors that need to be addressed.
A quick follow-up. We get this often from our physicians. What is the difference between an annual wellness visit and just a physical exam?
Yeah, the annual wellness visit is very structured in what you have to do. So CMS, at least on the Medicare side, they came out and said, here's what you have to do. It starts with a health risk assessment. So it's a lot of questions and it covers health history, surgeries. Are you at risk for alcohol, depression? It's a cognitive exam, ADLs, IADLs. So the AWV on the Medicare side, very structured. A physical is more of an exam in the exam room. So the AWV is a Medicare design program that, if done correctly, is very preventive. It identifies issues before they become serious, end goal, keeping the patient out of the hospital. So many providers will do a physical, but never take it to the next step and do all the things you have to check off for that AWV. So I think you could do both. And the AWV does have an office visit portion where the provider can do a lot of the things that you would do in a physical.
How can an AWV connect patients to other preventive care services?
That health risk assessment is what the AWV is based off of. So based on how the patient answers those questions, it's going to trigger some opportunities that the provider may want to suggest. So let's say that you answer that question and it turns out your home is at risk it's unsafe and you may be at risk for falls. So maybe we do a scheduled home visit. The doctor schedules that. Or maybe you answer some of the questions and you're at risk for anxiety or depression. The provider can make services or make recommendations. So there's a lot of different elements to the AWV where the patient can actually go home with a list of things that they want to do. And that final section of the AWV is supposed to be a 5 to 10 year plan. You need to have a colonoscopy every so many years. I want you to get a flu shot every year. Now COVID's a part of that too. So do they have to get boosters? When do they get cholesterol tests and diabetes tests? So it's good for the patient because you're doing it outside of that setting of that normal visit where you're typically seeing your doctor for one particular thing. This kind of allows the provider to step back and let's look at your overall health. Let's find things that we want to make sure you're doing or identify things you might not be doing. So it's good for the patient because you kind of get that time with the doctor one-on-one to go over your entire health history. And hopefully that leads to new services, or maybe there's something we missed and we need to do right away. So it has a win-win for the patient and the provider, especially as the provider is trying to do these things for value-based care.
Yeah, that my next question was to sort of kind of see where AWVs fit in sort of either the fee-for-service or value-based care models. And these models are often sort of pitted against each other. That while fee-for-service declines, value-based care increases, and vice versa. But do you think it's possible for these models to work together, or do you see them as mutually exclusive?
No, I think this one fits in both categories. And we talk to a lot of providers they're scared to death of switching to value-based care. They're so used to, our whole life I've been providing a service and getting paid for that service. And now I'm asked to, do something different. Where if you think about value-based care, the goal is to apply preventive care and keep the patient healthier, reducing readmissions. And so this AWV, you get paid to do it. And the reimbursements are pretty good, anywhere from 150 is the national average. If you do the IPPE, that initial welcome to Medicare visit, that's in the 170s. And even that subsequent one that you get every year, that's in the 110, 120 range. So you get paid to do it. Your staff can do a lot of the work. And if you do it right, it helps you on your value-based care goal. So I think a lot of these Medicare programs, and we help groups to find out which programs can help them reach those goals. Things like chronic care management, remote patient monitoring, they're all things you get paid for providing the service. So I think this whole middle ground area is a big opportunity for providers to kind of get into value-based care, but do it in a way that you get paid to provide the service.
So let's stick around with quality performance and value-based care for a little longer. What quality performance metrics can annual wellness visits help address?
Depending on which quality program you're in, and there's quite a few out there, it may vary, but I talked about fall risk earlier. That's a big metric that a lot of groups are tracking, reducing that. Let's say if you're a diabetic, there's things you got to do, like an annual eye exam or a foot exam, or keep your A1C below a certain goal. So you could use the AWV as a way to track all of those metrics. And then once you leave the wellness visit, you're reporting on those. And let's say you wanted to take this, to the extreme, make sure all your diabetics get a wellness exam. You would kind of accidentally be hitting all those quality measures at the same time.
Are there any challenges that physicians and other providers face when offering annual wellness visits?
I think a lot of doctors, when they hear the AWV, I'm too busy. I have a busy clinic. I'm short-staffed. And, we hear that from a lot of clinics today that, I'd rather just do E&Ms and the patients come to me when they need a service. But I think the advantage to this is that the majority of it can be done by the doctor's staff. So the doctor is, they hear this, it takes about an hour. I don't have an hour to spend. Well, that's okay. I mean, your nurse can do the first 45 minutes and you can come in at the end. So that health risk assessment, I don't know of any doctor that actually, spends 20 minutes going through the questions. Typically someone clinical in your office, your NP or your RN, even a medical assistant can ask a lot of the questions. So the doctor's coming in at the end to review the risk factors that were identified, to make recommendations, and to review that 5 to 10 year preventive schedule. So now if I'm a doctor and I look at that, okay, maybe I do have time for that 15 minutes. So while my RN is doing the questionnaire and the other things, I've done 2 E&Ms at the same time. So we see that workflow very effective in some of our practices that do a lot of AWVs. And that's a way that they can get revenue, but the doctor's not bogged down by all the things you have to do in the AWV.
How can technology help address these challenges that you just mentioned?
Yeah, I think in identifying a lot of the risk factors, particularly that health risk assessment. So if you gave the patient that clipboard in the office, okay, now someone's got to look at all the answers, but software like ours, and there's others that will take those answers and kind of do an analysis on them and look for risk factors. So based on this answer, this may be a potential risk factor. So doing that automation behind the scenes, a lot of doctors don't think that, when they start an AWV, how they are going to analyze that risk, but there's software out there that does it, and that makes it more efficient. And also making sure that you check all the boxes. Doctors are scared to death when you do a Medicare program. What if I miss something and I have a risk of getting audited? Well, that's where, if you do everything and that's outlined, your odds of getting through everything successfully and passing that audit, if it were to happen, is very likely. So software is really good at doing some of those things, and then telling you what to bill for. There's 3 different annual wellness visits. Sometimes there's modifiers depending on what kind of clinic you are. So I think a good software solution should also tell you how to bill for it, what data service to use, and things like that.
Last question before we go. Is there anything else we haven't discussed that you think it's important to mention to a physician and provider audience?
I think that just articulating that point that you asked about earlier, that the patients do like the service. It's not a burden to the patient. Sometimes when you call your patients and you want them to do different things, there's a little hesitancy. But we've seen groups that pitch it like a consultation. It's, hey, your doctor wants to reach out to you and do that free service from Medicare. And we've even seen groups where they're not sitting on an exam table. We've seen one group that they set up a couch in a certain room, and it's a candid talk with a care team member. And you get that feeling that, wow, my doctor's office and that nurse really took the time to listen to things that were important to me. And this was totally free. And so if you do an AWV correctly, the patient should walk away feeling amazing about their doctor. Now, that's going to be good for your patient satisfaction as well. But the doctor, their benefit, not only is it the reimbursement, but those quality scores should be going up because you're identifying things. So AWV is one of those things that if there ever was a win-win in services you could provide, I think this program is it. And I'd encourage any provider listening, do it with a couple patients. You don't have to, go crazy and do it with everyone at once, but find some patients who will do it and see if you get good results. And providers we talk to are all getting good results.
Dan Godla, thanks so much for joining me today and sharing your insights. I really appreciate it.
Thanks, Chris. My pleasure.